Hello, MetroEHS families. My name is Tiffany Peters. I am the Director of Billing for MetroEHS, and today I'm going to be talking about working with MetroEHS with Medicaid coverage. First, I'd like to touch on how insurance works when there's an autism diagnosis. Each healthcare plan differs, and visits are not always determined to be unlimited for all plans with an autism diagnosis. So it's best to work with your insurance company to know what your coverage is, because your plan will need to specifically state unlimited visits, or it needs to be sent to our billing department in writing. These are set by the insurance company and sometimes can only be changed with the submittal of appeals or submitting medical necessity documentation after services are started. The primary diagnosis of autism must be done by a licensed psychologist, and some plans also may have age requirements that require treatment to have started after 2 years of age but must begin before the age of 9. So please be sure to read your entire benefits plan booklet. With Medicaid, we do work with 3 Medicaid HMOs, Blue Cross Complete, United Healthcare Community Plan, and HAP Empowered. We are able to bill these plans directly for speech, OT, and PT services. However, if your child does need ABA therapy, you will need to work with your community mental health department, as stated on the right-hand side of this slide. The Community Mental Health Department will help you set up an intake, and then you'll be assigned a supports coordinator. Your supports coordinator will then coordinate with our office to provide authorization for services with Metro. This page lists the phone numbers for all of the community mental health agencies that we work with based on the county that you reside in. Does your child have an autism diagnosis? Because we are not directly contracted with Medicaid, your child must have an autism diagnosis to be able to utilize community mental health services for authorization of treatment. We will need documentation such as a script from a medical doctor or a diagnostic evaluation which shows the diagnosis of autism. Medicaid and private insurance. We do have some patients that have a private insurance through a parent's employer, and they also have Medicaid secondary. If a Medicaid beneficiary is determined to have private insurance, they will not be eligible to be enrolled in a health plan. This means that you will still have regular Medicaid, but you will not be enrolled in one of the HMO plans that we work with. So your private insurance will pay for services first, and then Medicaid will pay after your private insurance. But you will have to follow those steps that we addressed in the first slides about the community mental health department, because we cannot bill Medicaid directly. We will have to bill the county for any secondary charges after your primary insurance. That means if there's a copay or a deductible or a coinsurance that you have, say through your Blue Cross or your Priority Health, in order for us to bill those copays to Medicaid, we would have to bill them actually to the county, not to Medicaid. The difference between scripts and referrals, this often comes up as well. A script is a formal communication from a physician or other registered healthcare professional which authorizes them to provide a service to the patient. A referral, on the other hand, is the transfer of care from one clinic or provider to another. This is a pre-approval which allows a patient to see a specialist or a doctor within the same network. Without a referral, you don't have permission for the service. This slide here is a breakdown of all things insurance. It goes through what happens if you have Medicaid, what's a copay, what's a deductible, all the way down to what a supports coordinator or case manager is, which is what is required for the community mental health agencies if you do have Medicaid.